Events under our jurisdiction, we run an event calendar for the whole of WA. We have the calendar to identify which are the higher risk events, and that may be a running obstacle race sort of thing, a high profile event such as Ed Sheeran, with a real embarrassment to the state if things go wrong. Drug type events, there's stereosonic, those sorts of music events and rave parties. So we look at the calendar and we identify those if we think there are issues. Here at the Ed Sheeran event today, we're looking to start off outside the gates, look at the queuing at the gates, how they assemble, how quickly they get processed through the gate entry, because the first thing that upsets the event is if they have a bad experience on the entry. We're looking at crush points, narrowing down where the people have to get through in a hurry, the egress, the actual capacity on the pitch, make sure it's not too squashy, the general lighting, make sure that things are lit up, the exits are there, health and safety issues that are associated with the event. It comprises a pre-event check, looking at their risk management plans and their operational plans, identifying issues where things go wrong, which we learn through experience. We come down before the event, we look at the basic setup. These events, it's not finalised until a couple of hours before, so we can't check final barriers and stage barriers and the like until then. And the whole process depends on how much the people react and how the queuing works and all that sort of thing.
What we go through to meet the requirements, it commences with a very early consultation with the health department and the other stakeholders involved with the event. That includes the promoter and all our management services, from security to front of house to liquor licensing, food and beverage provision, etc. It's important to comply with health and safety requirements, because really safety is paramount. Patrons need a safe and comfortable environment if they're able to enjoy a show at our venue. So once they know that we've taken care of all the safety components, they can get out there and enjoy the act and have a fantastic time. I think for events like this, it's really important that we do specific safety drills and instructions, and that's why for tonight's event all of the key staff have been in here and have been inducted specifically on this event. It combines well with our annual emergency evacuations that we do for generic situations, but tonight is quite unique with nearly 33,000 people in the venue and 19,000 plus people on the field of play.
That completes our pre-event check of the safety things, and we allow them to open the gates now. The gates won't open until everyone signs off on the health and safety issues. It's only one event that we do, as I said before. From our perspective, we have a calendar, we monitor events. We estimate for this calendar year there's 6.4 million people have come across our desk in events, and about 2% of those will actually seek some medical assistance in the form of first aid, etc. And about 10% of those are estimated to go to a hospital ED department. So you can see it's a fairly important role. It's very vast. It's the amount of issues we cover are endless, and it's all about having a judgment on what's going to be healthy or safe